Dr. Catherine Graber from Coastal Adolescent Behavioral Health in Mount Pleasant, South Carolina. I want to talk to you today a little bit about Asperger's syndrome. Asperger's syndrome is also called high-functioning autism. Well, what does that mean? A child with Asperger's syndrome is very intelligent, so their IQ is usually very high, but they have a lot of social awkwardness. And the other piece to it is that they have a very narrowed focus of interest. For instance, a child with Asperger's would be, let's say, very interested in World War II and would know all the facts about World War II and be very accurate. And they would immerse themselves in knowing every single fact. So they'd watch the History Channel, they'd be reading, they would surround themselves with all that information. Well, unfortunately, that doesn't translate very well with other children of the same age, because not everybody is going to be interested in World War II facts on facts on facts. So what you usually see is these kids are bright, but they have a lot of problems mixing in with other children of their own age. And because that's all they can talk about is their particular interest. They don't know how to play in a reciprocal way that most kids do in a give and take, because they need to talk about World War II and they need everybody to know about it, and they don't understand why other kids wouldn't find this interesting. So that's really what Asperger's syndrome is, and as I said, we call it high-functioning autism. And there's a lot of press now on how the numbers of autistic kids has been increasing. And that's true. There are certainly more numbers of children that are being diagnosed as autistic or Asperger's. And part of the reason, but not all of the reason, part of the reason is because our diagnostic criteria for autism has changed immensely over the past few decades. And it used to be a very narrowed, focused type of diagnosis. And then we realized, there was sort of these other kind of subsets that didn't fully meet full criteria of autism. So, and they have been included into the diagnosis realm. So even if we took all that sort of expanded group, it still doesn't explain why we're finding so much autism. And autism is a hot topic for research these days. There's a lot of programs going on, a lot of grants being given for research on what causes autism, and then once we know what causes it, perhaps we can prevent it, and we'll know a little bit how to deal with it. What's very important for parents, if they're concerned about if your child has autism or Asperger's, is getting diagnosed, because that is key, because it has been shown in studies, particularly with autistic children, that the earlier you start giving them what they call early intervention, and that can be speech and language, that can be occupational therapy for a lot of them have gross motor movement problems, they're clumsy. When they get a little bit older, their writing is often poor, and their fine motor skills are underdeveloped. So if you can get children very, very early, it has been proven to be very effective. And also, kids with autism, they can learn. They can eventually have a job somewhere down the line, depending on the severity of their disorder and if they have any other disorders. So the key is early diagnoses. Autism is usually diagnosed before the age of 3. Asperger's, on the other hand, you may actually get into early school years, school age, sometimes middle school, before it's truly recognized. And if you have a question, please ask your pediatrician. And if you're unsatisfied with what your pediatrician or your primary care physician is telling you, bring it up again. Perhaps ask to see someone that specializes in developmental pediatrics to search out and make sure that your questions and your concerns are answered.